depression is not a chemical imbalance. I got a bit of pushback for saying that, but I want to talk about why it.
Hi, Dr. Rachel. I'm the person who made that comment. The full comment that I made was, I think that opening statement is reckless. Not that it was wrong, but that the way that you talked about it was reckless and potentially harmful. Your comment was, depression is not a chemical imbalance. And you're right, depression is not merely a chemical imbalance. There's a lot more going on, and your video and then the follow-up video does a good job of mentioning some of these other perspectives that are important. But it's also something of a straw man. No one in psychology, no one in psychiatry, no one in medicine claims that depression is merely a chemical imbalance. No one claims that it's the single and only way to combat depression. And broadly, I agree that the goal should be to enable people to make a much more informed decision about how they want to approach treatment so that a patient can go into their doctor's office armed with that knowledge. But what doesn't your video do? Your video doesn't say that medication can be helpful and life-saving in many situations. It also doesn't give people an avenue to take if they're currently on medication and they learn from your video that depression isn't caused by chemical imbalance. And we can see this in the comments of your original video. Here this person asks, if we are on an SSRI, should we talk to our psychiatrist about going off of it? You don't answer. I don't blame them for this question. If indeed depression is not caused by a chemical imbalance, isn't it reasonable to infer that therefore they don't need medication? Here another person in the same video straight up asks, so should I get off my antidepressants? And then some genius in the comments, Cosmic Manic, says, yes, go dance. You didn't respond to this comment. Broadly, this issue reminds me of the 2004 situation when the FDA put the black box warning on antidepressant medication, saying that this medication has a side effect of increasing suicidal ideation. Many argue that that was a bad decision, considering that black box warning resulted in a decline in the prescription of antidepressant drugs and then was associated with an increase in the rate of suicidal events among people with severe depression. People whose lives would have been saved by the medication didn't get it because of the anti-psychiatry rhetoric. And your initial comment dovetails itself in with much of the anti-psychiatry and anti-vaccine rhetoric that we've seen a big increase of over the last 15 years. This study also documents two patients here who refused pharmacological treatment, and this possibly led to increased risk for suicidal behavior. So what about those people in your comments who hear your opening, very powerful, very punchy sentence saying depression is not a chemical imbalance? You don't have any control over who sees your video. You don't have control over their level of education or their ability to take in broader aspects of the context surrounding mental health and the biopsychosocial model. What if one person decided to go off of their meds as a result of your video? Would you be comfortable with that? That's why I said that it was reckless. Not that it was wrong, but that it's irresponsible not to provide greater context. SSRIs are life-improving and life-saving medication for many people. Let me close with a metaphor here. Headaches are not caused by a lack of Tylenol in the brain, but Tylenol can be used to successfully treat headaches.